Hello, and thank you for joining us tonight for our free webinar, Medicare Roadmap for Licensed Acupuncturists, featuring Dr. Olivia Sue Friedman and Mina Larson. My name is Jeff Bloom, Education Marketing Manager here at LASA OMS. For over 40 years, LASA OMS has been striving to promote the growth of the acupuncture industry by providing quality products, great prices, and the best customer service, as well as supporting the many schools and continuing education efforts available. With our free webinar series, we intend to provide free educational opportunities taught by some of our industry's most renowned practitioners and educators. I would like to take a moment to acclimate you to the webinar room. To the right of the video screen, you will see 3 tabs: Chat, Questions, and Polls. To chat with other attendees or to communicate any technical difficulties, please use the Chat tab. For questions of our guest speakers, please make sure to use the Questions tab, and we'll get to those at the end of the webinar. And then tonight we did post a few polls and would appreciate if you take the time and answer them for us. And then please note that all of our webinars are recorded, and immediately following the conclusion, you will all receive an email with a link to view the video on demand and a copy of the slides. You may always visit our blog and use the free webinar tag to find all of our previously recorded events. From neuroscience to sports acupuncture to Chinese herbs, you'll find something interesting for every practitioner on the LASA OMS blog. Now for our featured speakers. Dr. Olivia Sue Friedman earned a doctorate in acupuncture and Chinese medicine from Pacific College, a diploma in traditional Chinese medicine dermatology from Avicenna in the UK, and an MSOM from the National University of Health Sciences. Before serving on the board of directors of the American Society of Acupuncturists, Dr. Friedman was one of the 2 Illinois delegates to the ASA and served on the Illinois Society of Acupuncturists as vice president. She serves on the advisory board of Learn Skin, the faculty of the Chicago Integrative Eczema Support Group sponsored by the National Eczema Association, and the NUHS Presidential Alumni Advisory Board. Mina Larson has served the NCCAOM for the past 18 years, moving up to the Chief Executive Officer position in July of 2019. Ms. Larson has devoted many hours overseeing NCCAOM's Regulatory Affairs Department, partnering with states to adhere to NCCAOM standards for the safe and ethical practice of acupuncture medicine. She also utilizes her years of legislative and government relations experience to advocate for the advancement of NCCAOM certification both at the state and federal level. Please join me in welcoming Mina and Olivia.
Hi, everyone. Thanks so much for joining us tonight. And thank you so much, Jeffrey Bloom and LASA OMS, for inviting us to present tonight the Medicare Roadmap. To kick off this presentation, I just wanted to give you a little bit of a background. As most of you probably know, January of last year, the Centers for Medicare and Medicaid Services, better known as CMS, decided to include acupuncture treatment for low back pain. And this decision was a major gift in so many different ways. But the problem is that licensed acupuncturists had to be supervised in order to practice, and they also couldn't bill directly. So without us being able to be fully recognized as full-fledged practitioners in the Medicare system, our voice and our ability to do certain things is pretty limited. So in short, we have all those burdens of Medicare, but we don't have any of the privileges. So we felt like it was really important to pursue this. And in order to do that, we need an act of Congress. Besides getting full access or being able to provide full access, we also recognize that the reality of Medicare inclusion is that it's actually a gateway for so many other opportunities in the U.S. healthcare system. It's the beginning of everything. So on July 23rd of last year, the ASA member state associations all voted in favor of pursuing Medicare so that we can then become practitioners. As a result of that, we started the journey, and it's going to be a somewhat long one. We have a strategic path that we have in place, and we have to align with a lot of favorable partners in order to do that. And in order to fortify our voice, we'll have to join with a lot of different people. We have to unify, we have to direct our profession to work in unison, and we have to identify and leverage the optimal timing to do all of this in order to generate all the different ways that we're going to needing to do in order to support this effort. So to start this endeavor, the ASA and the NCCAOM came together, and we built a leadership and advocacy team that's been working very regularly to map out the strategic plan. And we started to identify a basic timeline and, most importantly, decide at what point we need each individual to get involved. The official steps were actually drafted back in October, and then these steps were presented to the entire ASA on October 15th. And then from there, we actually decided that it would be really helpful if everybody knew exactly what this path was. And so we put together an infographic, which is what we're showing you tonight. The NCCAOM so generously offered to hire a graphic designer to put together something that was really clear and concise and easy to read and very professional. So I just want to thank Mina Larson so much for making that happen. So tonight, what Mina and I are going to do is share with you this infographic to help everyone understand at what point everybody should get involved and how it's going to move the profession. The roadmap also lives on both the ASA and the NCCAOM websites. So afterwards, you can go on there. I believe Jeffrey's also going to make this available to everyone afterwards. Since there's digital versions, there's paper versions that are also in Acupuncture Today, and we're going to be providing updates on a regular basis in Acupuncture Today as well. So before we get started, let me give you a little orientation of the infographic so you know what you're looking at. So basically, it gives you a really good sense of like how everything works. As you can see across the top, we've identified different steps that require immediate action, what steps are going to occur sometime in 2021, and then things that are completely contingent upon other things happening first. So if you actually go to this map on the website, it's actually interactive. And when you actually click onto each of the different stages, it'll open up and it'll provide all this detailed explanation. But instead of clicking on it, what we're going to do is actually flip through this like a PowerPoint presentation, so it's a little bit easier for everybody to see. I'm going to take you through steps 1 through 5, and then Mina's going to take you through 6 through 10. All right, so let's get, oh, you know what? Before we start, let me just let you know that the timeline is incredibly loose, and it's really subject to a lot of different factors. And to be really frank, the pandemic is really going to be a large factor in how quickly we run through this. And there's a lot of unexpected events that can impact this as well, such as things that happen on Capitol Hill, insurgencies, impeachment trials, things like that. They all can make whatever we're doing a lower priority to the legislators. So we need to be really flexible, and we need to accept that whatever comes up, we just have to adapt to. Lastly, I just want everybody to know that I know everybody wants to just get down to their legislator's office and start banging on their doors and start talking to them about Medicare. We absolutely would love you to do that at some point, but not quite yet. There is a perfect time to do this, and we're going to talk a little bit more about what that is. Also, I want you to know that you don't necessarily have to support this effort by just being in legislative or advocacy. There's so many other opportunities, and we'll talk about that as well, that will support this effort too. So if we go to the next slide, we'll start with stage 1. So stage 1 is basically just trying to put together, the organizational support and trying to understand like all the different stakeholders that are involved, everyone who should know about this, who should be involved with this, and who do we get to work together with. This is something that NCCAOM and ASA has been working on. We have a huge Excel spreadsheet that we put together that has a list of all these different leaders, all the different regions, all their contact information. And we have like an outreach to all these different groups in order to start bringing everybody in together. That's something that's been going on for a little while now, and it's going to continue to build. We're always going to be adding to that. Next slide is stage 2. So this is where we really are right now. We're trying to actually put together the bill language. Without bill language, we really don't have anything to talk to you about with any of the legislators. So it's really important to get this right. Right now, Ellen Hamilton of the staff of Judy Chu's team is in the process of strategizing what exactly would make the most sense. We want something that's very, very focused. In previous years, other bills have included a lot of other information, a lot of other things. We want this to be a lot more focused. So we're working on that right now. We've got lobbyists from the NCCAOM who are helping to work on that, our advocacy team, for both ASA and NCCAOM are working together on that. So that's where we're at right now. That's the biggest thing that we're working on. And once we actually get that in place, that will lead us to the next point. So you can go to stage 3. And as you notice, all of these stages so far have been green. So that means that, they're now an ongoing. And then, when we get into the red things, which is stage 3, these are things that are starting to be in 2021. So once we get the bill language, we'll actually go to stage 3. And that's where we start to secure bipartisan support for the bill. So it's really important that we don't just get one group. Like, we have to have as many people as possible supporting this. So we'll be going after both groups. This is something that's going to be going on for a while. It's really hard to say how long that's going to take. So, it's something that we have to keep watching. So we can go to the next slide, and that brings us to stage 4. So stage 4 is going back to an ongoing thing that we're starting right now. We're putting together a congressional packet, and in this is a lot of different kinds of information that talks about, the benefits of Medicare recognition, all the different talking points that we want to have, different data that addresses like the cost effectiveness of acupuncture, what exactly the quality of it is, the accessibility, the effectiveness. What we want to do is put together a biomedical document that includes effectiveness compared to other kinds of treatments, the role that it plays in opioid use, what it's been done so far in the Veterans Affairs and the DOD, and what's happened in terms of acupuncture in there, so that we have a lot of different kinds of evidence points to show. And then we also want to put together a workforce document that shows the numbers, the geographical map, licensure requirements, and education and training, so people have a really good understanding of like who's actually doing this, how strong are we in terms of our licensing and educations and whatnot. So that's an ongoing effort as well. So that brings us to stage 5. And at that point, what we're going to be doing is gathering a lot more support for research that's going to help our cause. We're going to be looking into all different kinds of evidence, whether it be, environmental scans that kind of look at everything and bring together all different kinds of things, or we're going to be actually putting together short pilot studies to actually fill in whatever gaps we happen to have so that we have even stronger evidence. We're also going to do a lot of systematic reviews. So that's something that's also ongoing, and that's something that our research department or committee is doing at this time. So Mina's going to take you through 6 through 10. As you also will notice, at this point in time, acupuncturists haven't really been involved. It's really been a lot more of the leadership teams that have been involved.
Thank you so much, Olivia. So as Olivia set the stage for the first part of the Medicare campaign, and this is, again, as Olivia said, a profession-wide initiative. This is something that we really need to get the profession to be part of it, because it is going to be so impactful in terms of moving ahead and getting recognition in other areas of the federal government. So stage 6 is going to be the targeted high-level advocacy, which really is starting to focus and lobby and inform and educate committee members. So again, depending on how many co-sponsors we have, who those co-sponsors are, as Olivia mentioned, we want to have a mix of co-sponsors that are both Democrat and Republican. We definitely want to get sponsors, and when I mean sponsors, I mean members of Congress, both including the Senate and the House, right? And we want to make sure that those members are from the Ways and Means Committee and the Energy and Commerce Committee as well. Those are very two influential committees that really control some of the financial aspects of Medicare. Again, you never want to have a bill that's going to draw attention to the fiscal impact or have a major fiscal impact. We want to show that we're actually a cost-effective medicine as we are, and that we're going to save the government money and open access. You know, as I like to say, the Republicans always want to look at the fiscal impact, and the Democrats are very, they really want to see access in terms of having as many patients have access to our medicine. So those are two important parts of what we have to do. And as Olivia mentioned, with stage 5, with the research, this is where the research comes in, so that we can have cost effectiveness research. We have studies that show the the efficacy of acupuncture broken down into different ailments. As you know, the current the CMS requirement is just for back pain. We're hoping to expand that to many different ailments and also remove the supervision that's currently in the CMS requirement, so that we are an independent profession and independent providers. This is a time that we actually want to outreach to the states as well, and this is where ASA, with their excellent outreach to the state associations, are going to really put together messaging to work with the states and also get onboarding from state associations. We also want to look at data from states that have Medicaid coverage or any type of coverage that's coming from the states, because, you know, as you talk to government officials, the federal government really pays attention to government data. Government likes government data. So any type of state Medicaid or collected data would be valuable for us to be able to present. So the outreach to states will be important to make sure that we get that buy-in and support from state associations. Outreach to NCCAOM diplomates and ASA state associations and their members about the bill, and ways individuals can help support the bill. So this is when the actual grassroots advocacy starts to kick in, and this is where it starts to get exciting in terms of getting people on board. And I want to go back to what Olivia said, which is so important about messaging. We want to ensure that we have the same messaging and that we're on target and also collaborative and unified with our messaging. The last thing we want to do with the federal government is look like we're fragmented, or that there's discord or conflict within our profession. We don't want to do that, because that's not only an embarrassment to our profession, but then they see us as not a viable option for Medicare and other federal recognition. So this is where we're going to really be coaching and working with the state associations and diplomates and all of our wonderful practitioners to really work together so that we can outreach to individual, state representatives, your local Congress persons, and also advocate at every level, so that we bring awareness to the bill. By this time, we'll have a bill number, we'll have co-sponsors. So this is the part where we really do majority of our outreach with our practitioners. So the timing of this, and of course, this is during and after the bill introduction. So as soon as the bill is introduced, then the committees are assigned. We start to go ahead and target the committees, and then that's your time where we actually start putting together the communications regarding the bill. And this is where stage 7 comes in. Stage 7 is bill introduction and official advocacy launch. This is where the go button is hit. Okay, we have a bill. We're going to go ahead and try to send out toolkits, information, letters. All of that is when we start working on making sure that information goes out to local congressional representatives. This is where we work with congressional champions and the timing to introduce the bill. So the timing is very important. We don't want to be, if we start communicating to legislative members before the bill's introduced and before it's ready for committee assignment, or before it's actually assigned a schedule, then they're going to throw it away. Staff members will be like, what is this? They're so busy, they don't have time. So if you send information to them too early, they're not going to pay attention to it. The timing is very, very important. This is where we're going to follow the lead of the government relations experts that we're working with. They'll be the ones that will guide us towards when the right timing is going to be happening. And NCCAOM and ASA are going to be really working collectively to organize grassroots and media efforts to coincide with introduction. Media is going to be an important part of this. As I always say, congressional representatives do pay attention to what's on the news. So if we get a lot of exposure through the media, whether it's through social media or particularly through the news, the news outlets, then it'll get more attention, and people are much more likely to pay attention to it. As you know, Medicare's what's happening with the opiate epidemic that happened before the pandemic, which has gotten much, much worse now. All of those really very newsworthy items that are also bipartisan are going to be very important for us to really showcase now. There are bipartisan areas of agreement. There are not many within Congress right now, but one of them is the opiate epidemic. So this is an area where we really bring traction by really putting attention on the efficacy of our medicine for particular conditions such as pain, addiction, substance abuse, mental health. This is where we're going to really need to put together information to send out. The information needs to be consistent, and it really needs to be guided. So this is where we're going to be coming in to really put it together and help our practitioners and state associations. We have some legislative toolkits and tracking kits that will help with that when we get to that stage. We also want to organize acupuncture advocacy campaigns to increase awareness of the bill and gather more bipartisan co-sponsors. The more co-sponsors we have, the better it is. When a member of a committee is looking at a bill and there's about 20 sponsors, 20, 30 sponsors, it looks better. There's less chance of the bill dying. So this is where our advocacy government relations folks will come in and really start to go from office to office to office to try to get as much bill support as possible. And you can see on the very top of that this little stage 7, the little LAC sign right next to the person up on top. That means that kind of signifies that we want this is where we need our acupuncturists involved, directly involved in that stage of our campaign. So then we move on to stage 7, which is the high level and grassroots advocacy. This is a continuation of the work that we're going to be doing for stage 7, which is really developing a grassroots advocacy campaign. How to do that, we have to be very organized about it. So this is where we're going to be putting together training webinars, how to be able to speak to members of your local congressional representatives, how to be able to approach them, how to write letters, how to be able to talk to the media, because many of us don't know how do you get an interview with the media. This is all of the training we're going to be able to do and work with you on. How to put together particular customized toolkits that will help bring the local flavor of this bill to your local congressperson. We're going to be doing a lot of town halls at that time as well. So this is where we're going to be really, really busy, and hopefully, as we want the masses of acupuncturists all together moving towards the stage of the advocacy. We want to identify and confirm organizational support. This is the time when we go out and start going outside of our medicine's arena to talk to physicians, talk to chiropractors, talk to nurses, physical therapists, even people that we might not get along with. We have to get along. This is our time to get their support, to show that we have solidarity, to show that other healthcare supporters, mental health. I mean, I can't emphasize how important it is for us to get support of mental health providers and mental health organizations, to show that they support acupuncturists for Medicare. We want to identify and engage any type of pain representatives of pain management organizations who will be big advocates for us. There's some coalitions out there that like the Voices for Non-Opiate Choices and others that actually do a lot of great work for alternatives to pain, to opiates, that we want to get involved with them. So again, the more voices, the more collaboration, the stronger we are in presenting our bill. We want to plan for incremental communication with professions for updates and feedback. This is a time we're going to be sending a lot of information to our acupuncturists, as well as really making sure that we're not only getting feedback, we're not only sending out feedback, we're also getting feedback from our acupuncturists so that we can answer your questions during this time. We want to develop an organized coalition support list. We might even be able to start a coalition ourselves, gather others who are really wanting to push, non-opiate alternatives or others to join our group to really support our bill. And then also communicate advocacy plan and engage groups with professions. So again, this will be our most busiest time. And again, the timing for this, in terms of how long this will last, we don't know. As I said before, as Olivia said earlier, we don't know what the life cycle of this bill would be. If 2021 is going to be a more normal year, then things might be faster. If it's going to be something, where, God forbid, there's a variant and COVID numbers go up or some other disaster happens, then we have to delay it. So it's very important to know that the legislative process, particularly in Congress, we can't really put a timeline on it. So we're expecting, again, to introduce the bill hopefully sometime this year, but all of these stages will take time, and we really have to be patient to work within that setting. Then we're going to go on to stage 9, which is the publicity and communications. Again, this is making sure that our community is updated on the bill's progress and how the impact of the advocacy efforts are affecting the bill and where the bill is going. Letting everyone know what the bill's success and what we may need from the community. Developing educational materials about the impact of Medicare recognition, Medicare enrollment. This is where we're getting towards the end stage of the bill. This is when we'll be able to have more information. If there's any amendments to the bill or anything that we need to work on, this is the time we'll be able to work on that. And this is the opportunity for us to also be able to talk very deeply about Medicare with our practitioners so that they have a better understanding of Medicare recognition to them as providers. So we're going to be updating our websites. We're going to be providing information. I'm sure we'll have billing experts there to help us and to be able to provide information for those that are interested in accepting Medicare. We'll be working with Acupuncture Today and hopefully other, sources of media. Hopefully we'll get mainstream media involved in this because it is a big deal to have acupuncture covered for many different ailments. And then compile, develop, and publicize case studies. This is a continuous. I want to stress the importance of the continuousness of research. Research doesn't stop and say, we have the bill, we're finished with it. It has to continue. Every time that we can collect research to show the efficacy of this medicine and to be able to demonstrate that and create studies, the better it is for us. Once Medicare happens, once we open the doors with Medicare and we become full providers, then other doors will open with other agencies, hopefully within the Department of Defense and hopefully within other agencies, which is why we need to consistently collect data and case studies. Hopefully we'll be able to collect, will be ideal for us to work with NIH to be able to collect, research through once we become full participants for us to collect research and be able to showcase that with the NIH. And then stage 10, which is the last stage, which is a long-term congressional and public advocacy efforts. This does not mean the end. This is just a long-term plan that we need to follow and track once our bill is introduced. And basically, as you know, the bill has to go through both houses, both committees at both the House and the Senate, and then get signed by the president. We also do have to make sure that we lobby and inform the Biden administration, and this is something that we're also doing now. We want to make sure that we make connections within the HHS and all of the different, health champions that are working within the Biden administration, because once the bill, you want to make sure that the president is aware of the bill and he's going to be supportive of the bill. What you don't want to do is have him veto it when you do all that work and it doesn't get confirmed into law. So again, this is an ongoing effort of us really working with both houses and the Biden administration to make sure that everyone has agreement on this bill. We want to go ahead and continue to work with Democrat and Republican co-sponsors even after the bill. We want to continue to be friends with them and communicate with them, not just ASA and NCCAOM, but you as a local acupuncturist. You want to maintain that relationship with your local congressperson so that they are updated on our profession and that we continue to open the door in federal recognition. We want to prepare a cost-effectiveness case for a congressional assessment. Cost-effectiveness is so important right now because, as you know, the country's struggling. This COVID relief bill that's going to be passed is going to be a big strain on the financial structure of the federal government. So anytime we can show that we are saving money in the healthcare system, it'll be really, really advantageous. We want to continue to support bill as new information arrives, new data. How, some of you have heard that there's a lot of inquiries and studies about post-COVID, post-COVID cases, and how do we deal with that? Anytime we can collect that information, NIH put out a recent action item for those people that are interested in showcasing or putting together research on post-COVID. All that information is new data that will be helpful to the government as they're moving forward towards improving healthcare. Additional supporters, any type of endorsements, and again, I cannot stress collaborativeness, moving outside of your circle of your acupuncture community and going out and meeting other organizations, other healthcare practitioners, hospitals, bringing as much collaboration as possible, bringing awareness to it as well as patients. Patients are very important. And then, of course, additional CMS coverage decisions. We don't know what the finality of the language of the bill is. We're going to try to go for it as much as possible. But the determination is going to be up to the policymakers to determine exactly what what is going to be the wording of the bill, and what are we going to be allowed to do and not do. One of our main goals is to remove the current supervision that's there right now. We want to be independent providers there. So at this point, I'm going to go ahead and I know some of you have a lot of questions, and I want to turn it back to Olivia for a wrap up, and then we'll be able to answer your questions.
Well, thanks you, Mina. I think that was a really great overview, and hopefully that helps everybody really understand what the different steps are and when everybody gets involved. If you didn't notice, LACs actually don't get involved until step 6.
Yes.
6. So all the other stuff is all background work that needs to be done before we actually get to that point. And also to manage expectations. This is not something that we see happening really quickly. This will probably be like between 3 and 5 years. So it's going to be a little bit of a marathon. So the other thing I really want to stress is that there are lots of ways to get involved with this project. You don't have to just be somebody who's really interested in advocacy or wants to go down to talk to your legislator. There's a lot of ways to support this effort in other ways. One of the biggest things that we're going to have to do is to show that we represent a large group of this profession. And right now the ASA represents a good percentage of it, but not a huge percentage of it. And what we could do is actually make that number larger, so that when we actually go to each of the different legislators, we can say we represent 75% of the profession, 80% of the profession, 100% of the profession. So membership is really, really important. And so behind the scenes work to do that is really important. How do you get members? Well, you got to have benefits, right? So we would like to work on a lot of different other benefits that state organizations will automatically get if they're part of the ASA, and therefore the state association members would get as well. We have things in place like malpractice insurance and things like that, but we'd really like to beef that up even further and have even more interesting things. So joining a committee to be on a member benefits committee would be great. Another thing that's going to be really important that Mina brought up is communications. I mean, I cannot say enough. Communication is everything, whether it's talking to other LACs, or even talking internally within ourselves, but more importantly, talking to the public, talking to legislators, putting together different things, different pieces of materials or tools or whatnot. You know, there's a lot of background work that has to get done to actually put those things together. You don't have to talk to anybody to do that either if you're an introvert and you don't want to get out there. So there's a lot of other ways that you can be there. We also need somebody who, or numbers of people who are interested in helping us with technology. You know, all of these things work a whole lot better when you have good technology in place, whether it's an app, whether it's a really good system that allows us to send, you know, information to all the state organizations back and forth and things like that. So people who have some expertise in that area, we would love your help. And another area is, as Mina was talking about, we really need to collaborate with every group that we can that can help us, whether it's an integrative group, whether it's another group that is in the healthcare field or anything like that. So if anybody has relationships with those kinds of people or institutions, I mean, we would love for you to get involved. So there's many different ways to get involved. If you're part of your state organization, you can join any one of these committees. We also have other committees like the Advocacy Committee, the Herbal Committee, the Governance Committee. We have lots of committees for any kind of interest that you have. So please, I think that Medicare is going to help all of us in the profession in so many different ways. I know there are a lot of people who say, gosh, you know, I am a cash business. Why would I ever care about this? Well, the thing is, the more access that we have, the more we can play a part in the healthcare system, the more voice that we have in being part of that and being able to do more and having access to more and more of the populations that are available. And I think at the end of the day, we all want to help as many people as we can. So please get involved with your state organization so that you can be part of the ASA and help us do this so that we can all be better in every single way that we can. So anyway, I want to give this back to Jeffrey. Again, I want to thank LASA OMS, Jeffrey Bloom, for setting this up. This has been such a great opportunity to share the information, and it's always a pleasure to see Mina. This is one of the few ways I get to see her.
Thank you,
so it's always been fun doing that, and thanks so much for doing that. So I'll bring it back to Jeffrey, and I guess we can open up for questions.
All right. Well, we do have some questions. I do think some of them might not be 100% on topic, so it's okay if you say that. So let me get into it. Our first question: does acupuncture share RVUs with PT and OT for Medicare payments?
That's probably a question that's better answered by somebody else.
Yeah. There's a lot. I understand there's a lot of questions on billing, and I think Olivia and I in our town hall meetings last year had brought some billing experts to be able to discuss specific questions about billing. So what we can do is, if there's any specific questions on RVUs and billing, we'll save those up and try to get back to you on those questions. We have some billing expert folks that we can work with on that.
Perfect.
One thing I will say is, I know a lot of people have concerns about what is this going to mean in terms of billing? What's it going to mean in terms of, how much you get paid for these different things? And I will say this: we have to be part of the game in order to play it, right? And so until we're actually part of Medicare, we really don't have much of a voice to be able to be in that conversation and negotiate anything different. So when I was saying that this will open up different opportunities, or this will be the gateway, these are some of the things that it will open us out to. So if you have thoughts about that, this is one of the reasons why it makes sense for us to, pursue this further.
Right. And I see Amy, who's part of the advocacy NCCAOM, Amy, who's part of the ASA NCCAOM advocacy team. She says RVUs are set by procedure, not by the practitioner doing the procedure. I know she's been working with some of our billing experts on that. So thank you, Amy.
Always very helpful. And then next question: is a chiropractor certified in acupuncture permitted to bill directly for acupuncture?
So a chiropractor who is NCCAOM certified, who's actually has gone through the training, ICOM education training, and then has taken all the NCCAOM exams, they're pretty much considered a licensed acupuncturist because they're eligible to be state licensed. So in that point, yes, but they would have to go through the training and education of what we have. Now, chiropractors, of course, as you know, they have per state, they have their own requirements. They have their own examination. Of course, it's nowhere near the education hours that we do have. So, so chiropractors' educational hours and ability to practice varies by state. So, currently, the CMS language that CMS introduced last January says that they have to have gone to an ACOM accredited school. So chiropractors have, if a chiropractor is NCCAOM certified and had gone to an ACOM accredited school, then yes. But most chiropractors that are out there have not gone to ACOM accredited school, so they would not be eligible to participate through the CMS guidelines that were published last year.
Alrighty. And then next question: what is the fee schedule or reimbursement for acupuncture treatments with Medicare?
Well, that's another question I think we have to get back to you on, because we don't have that specific set number. Yeah.
I think actually all the questions on fees and all those kinds of things, I mean, I think you can probably send them all to us and we can get back to you. We can have our insurance committee actually take a look at that and give you some very, very defined answers. But I don't think Mina and I can give you good answers at this point in time.
Yeah.
All right. Well, thanks for letting me know. So what I'm going to do is any question that's about fees, I'm just going to send you guys offline, and then I'll share those answers on our blog along with the recording. So if anybody wants to check back, maybe in about a week or two, we'll get answers to these questions up there along with the recording of the webinar.
Perfect.
And then, so I do apologize about that. So moving on, next question. I do not have a master's degree as a licensed acupuncturist. The current regulations also require the acupuncturist to have a master's degree to treat Medicare patients. Will the proposed bill also address the issue of allowing someone like myself to treat Medicare patients?
So that's a very good question. The current requirement that CMS, again, this is what CMS's decision, that they have to have graduated from an ACOM accredited school. We are looking to change that to require licensure or certification, so that if you are state licensed, actively cited with no disciplinary record, you'll be eligible, or you're NCCAOM certified. So again, if you were able to meet your state licensure requirements, then that should work. Or if you have NCCAOM certification. For NCCAOM certification, we have many diplomates who, through through the credential reviewing process or other previous process don't have a master's degree or haven't graduated from ACOM, because as you know, there are many, many people who went to school outside of the U.S. That came through NCCAOM that don't have ACOM accredited schools, and that would make it very difficult, particularly members of the Chinese and Korean community who are practicing here in the U.S. and don't have an ACOM accredited education. So that's something that we're going to be looking at. We do want to make sure that we are being inclusive in the bill. Of course, there has to be standards. The government is not going to say, okay, everybody come on in. There has to be national standards, but we want to make the national standards inclusive so that we can provide greater access.
Well, that was a great answer. Let's see. Next question. This one you guys might not know, but I'm going to ask it anyways. What percentage of acupuncturists are actually already billing Medicare now?
That's a hard. I know we do know that we haven't tracked that or surveyed that yet. We do know that there are acupuncturists that are billing Medicare through Medicare Advantage, and some that are billing through for the back pain and are working with the set guidelines that CMS has stipulated last year. We don't have a number on how many those are.
I think it's also difficult to track because so many people are doing it through doctors right now that we're not really sure if it's the doctor or if it's somebody through the doctor.
Right, that's a good point.
That makes sense. Let's see, we have a few more questions here. Next question is, can a doctor out of network refer me, an acupuncture patient, for low back pain?
Can a doctor who's not part of the Medicare, who's not a Medicare provider?
It says out of network, so either not I guess not a Medicare provider.
And I'm not sure about that one. If someone is a non-Medicare provider can refer, that's a question that we can look into.
I think referral is a completely different thing, though. I think at the end of the day, you still have to be supervised by an MD. So it doesn't matter where you got the referral from. What matters is that if you are actually practicing under Medicare, you have to have a doctor who's supervising you.
And it's important, acupuncturists cannot directly bill for Medicare at this point. I know Medicare Advantage is a little bit different. So I think that's one of the main reasons why we want to have this bill, so that acupuncturists can bill. Two main reasons. One, acupuncturists can bill directly, and that it's not limited to back pain. Those are two important. And also the whole situation with eligibility. You know, we want to make sure that we have that, really work on the language for eligibility.
Alrighty. Can an acupuncturist currently treat out-of-pocket Medicare patients?
Out-of-pocket Medicare patients. I'm not sure. I think that's another one that we're going to have the insurance committee answer.
Yeah, for sure. Yeah, I think anything billing related is something that is not our expertise.
Yeah.
Sorry about that.
That's okay.
Let's see. Actually, somebody said that they'd like to share this video with a group of acupuncturists. Do you have a problem if I share that video with this practitioner who'd like to share it?
Sure. That's the more information.
Yeah, the more people who know about this, the better.
All right.
As long as LASA OMS is okay with it.
We are perfectly fine as long as it's not being used for anything nefarious.
Yeah. I do. Go ahead, Jeffrey, because I have a, out of one of the questions that someone asked, I think there was a follow-up question that I can answer, but when you're,
But that's perfectly fine. What were you going to say?
Well, there's a lot of questions about whether private insurance is going to be impacted with Medicare. Yes, absolutely. Once we get, and that's one of the, going back to what Olivia said, that there's going to be a lot of doors that will open, and once we are able to be full Medicare providers without supervision, it will impact private insurance as well. And that's information that, again, private insurance is watching what's happening with Medicare very carefully. I can tell you, even with the CMS decision, which was limited, there's been interest with private insurance. So that's going to definitely be a benefit for us. And again, for those people who want to participate, if you don't and you want to be cash-paced, that's fine too.
All right,
and I think that's the key, is like it allows everybody to do what they want to do. So if you want to bill through Medicare, that's fine. If you want to continue with a cash practice, you can do that. I think the beauty of this is that it allows everyone to be whoever they are and practice however they want to.
All right, well, we only have one more question left. And let's see, I know you said not to start talking with our Congress members about this now. What messaging would you like us to start using to begin the communication process?
So we need the bill language to be finalized, and then we need our communications department to actually put that language together. So all those steps that we just talked about is all those things that have to happen before the LACs get involved. So have some patience. We have a lot to do before we get there. I know Mina and I got through this in less than 45 minutes, but it's definitely going to take a lot more than that to get that kind of stuff together. Yeah. So like I said, this is going to be a marathon. This is going to take between 3 and 5 years. So have patience. It's going to take some time. We want to do it right. And so we want to take our time and actually put it together in the perfect way. We want the right people to be involved every step of the way. We want this to be professional. We want to bring in people who can help us polish and do all those kinds of things. So we will keep you up to date. As Jennifer put in the chat, Jennifer Broadwell is actually the chair of our advocacy committee, and Amy Major is the vice chair of our public policy group in the ASA. They will be continuously updating everybody on this. So Acupuncture Today will have monthly updates, both in the digital as well as the printed form. We have a newsletter. The ASA has a newsletter every single month, and we have updates in there from the advocacy committee specifically. Anytime anything happens that's large, we will make sure that a statement goes out through the ASA. Amy Major does a fantastic job of keeping everyone apprised of what's going on Facebook and all of our social media efforts and distribution. NCCAOM has a lot of things going out on their website as well as their social media as well. So just keep your eyes open. You should always see things from us as things happen, and as we need you to get involved with different things, we'll definitely let you know.
Absolutely. And I just want to emphasize the importance of joining your state association. As Olivia said earlier, that's how you can really empower the state association to work with the ASA to get things done, particularly when we're doing this, the steps with the licensed acupuncturists involved. That whole power of advocacy and grassroots will happen with the state association. So if you haven't joined your state associations, please do so. It's important that you do so, so we can all collaborate and really have the messaging together.
And I will also go one more step with that too. Again, I think there's a number of people who feel like I'm not really an advocate. I'm not really somebody who's going to be running down to my senator's office or House of Representatives office, and that's okay. If you are that person, then joining your state association actually gives your state association money too, and that money actually helps this process. It actually helps to support us in terms of saying we have one more member, and every single time we can say we have more people who are part of this, the stronger we are. So there's a lot of different ways to support this effort. Please don't feel like there's only one. There are a lot of different levels, and depending on what you're interested in and what you can do, what you have time for, you will help us in some way, shape, or form.
And while we were talking, we actually got a couple more questions. So if you don't mind,
Sure.
First of the new questions, what does supervision under an MD entail?
So this is not very clearly defined in CMS language. When you look at the CMS language that's stated, it doesn't have a clear definition of exactly how this physician has to be supervised. I mean, we've in some instances there has to be direct supervision where the medical doctor is within the same practice. So because that's not clearly defined, I believe that from my understanding of this, and correct me if I'm wrong, Amy and Jennifer, because you guys are in there doing a great job with the chat, that you have to have a relationship with the medical doctor, and they have to be able to come in and check in with you. I don't believe that they have to be in the same office as in direct supervision. But again, we've asked, that's one of the things we've been asking CMS to further define with us so that we can have clear direction. But again, our objective with this bill is to remove supervision completely, so that we are independent providers. And one thing that's going to strengthen the case for that, as you know, within state regulation, there were many states when we first started out years ago that actually had supervision listed within the state requirements, many states. And a lot of those supervision requirements in states have been removed because of the fact that we are trained, educated, and we have the assessment to be able to practice independently, and we have demonstrated safety. So all of that information from the states will be used to remove supervision at the federal level.
All right. Well, you have one more question. And it is, since Medicare only covers low back pain, I don't see any reason that we couldn't take cash out of pocket for non-covered diagnoses. What I wonder is if we can treat low back pain for cash, since this is a covered service and we are not Medicare providers.
Well, I'm not sure. Yeah, I'm not sure if we could actually do that. If we can go ahead and you know what? That's a question that I think we'll have to go ahead and get back to you on, because you have to go back and look and see if you could actually, you could actually treat a patient using cash under the Medicare guidelines. I'm not sure. So I don't want to give you the wrong answer. So we'll have to go ahead and get back to you on that.
Yeah, like I said, I mean, all the billing questions are not something that Mina and I are experts for. And that's why we have an entire committee that does this 24/7. So we will definitely get back to you with very direct answers. Just send whatever questions you happen to have to Jeffrey, and we'll be happy to get back to you.
All righty. And it looks like a few people have chimed in the chats to clarify on that one.
And one thing, though, going back to that question, if the person that asked the question means that can they still bill for cash for back pain? Yes, they can. I just want to make sure if I understand the question correctly.
I think that's actually what they're asking. Is
yes,
if
and
they
then
can
yes,
just,
I was trying to. So yes, so
as long as they're not billing.
This is very important. Just because Medicare is, again, we go back and we start including all of these different ailments and diseases, right? And Medicare is going to cover them. That is not going to preclude people, those cash-based businesses from being able to treat. So, for example, if you want to treat back pain for cash, you can actually treat back pain for cash. Medicare isn't going to come out and prevent you from doing that. So, if that's what the question is, absolutely you can treat it. I thought I was thinking that the question was can they bill Medicare? I made it much more convoluted than it was. So this is important for all those folks who want us to continue to have a cash-based business. Medicare is not going to prevent you from having to do that. You can continue to keep your cash-based business, and so one is not going to take out the other.
Right. And we're going to set it up that way. That was the whole point. I think we had lots of discussions early last year about, what does this really do for people who don't want to be under an insurance company or don't want to bill that way? And that was a contentious point. I mean, there's a lot of people who don't want to have, anything to do with that. So we agreed that if we're going to go forward with this, this is the only way we're going to do it. And we want everybody to be able to practice how they want to practice.
Exactly. That's a very good point.
Well, I cannot thank you both enough for your time tonight. This was so informative, and we had a ton of people really appreciate this and great questions. Really just thank you for all of the work that you do, from LASA OMS and from the industry. We know that a lot of what you guys do is very thankless, but it is very much appreciated. We do know how much time you guys put in, and a lot of that is in addition to treating and having lives of your own. So from the bottom of our hearts, thank you for all that you guys do. The industry appreciates it. I want to thank everyone who showed up tonight. We really appreciate having you here tonight. Our next webinar is actually going to be next week on Wednesday the 17th on practical auriculotherapy featuring Marie-France Collin. It's going to be extremely fun, so please register. It's up on our blog. We also have our part 2 of Ask Me Anything About Sports Acupuncture happening at the end of the month, so you can register for that as well. Definitely sign up for your state association. There's links in your email that's going out afterwards, and we hope you all have a wonderful evening.
Thank you so much for having us here. We appreciate it. Thank you, everybody.
Thank you.
Thank you. Thank you, Jeffrey. Thank you, LASA OMS. Thanks, Mina. It's good to see you again.
Bye-bye.
Good night.